Hi, welcome to our video abstract at IBD Live. We want to tell you about the work that we've been doing looking at the patient understanding of the risks and benefits of biologic therapies in IBD using insights from social media. My name is Viviana Martinez, and I'm a research specialist at Cedars-Sinai Medical Center.
And I'm Francis Daly. I'm an internal medicine resident, also at Cedars-Sinai Medical Center.
So we know that biologics are a mainstay therapy for severe and moderate IBD, but we also know that biologics have very complex risk-benefit profiles that are often hard for patients who are looking at initiating or continuing or discontinuing these therapies to navigate. Some research has been done looking at this decision-making process in patients, but it's been focused on focus groups or surveys that have traditionally had smaller sample sizes, making the results of these studies hard to generalize to the general IBD population.
And we thought social media is a promising data tool to examine specific populations, such as patients with IBD. Up to this point, there have been few attempts to understand the patient's understanding of biologic therapies outside of traditional surveys, clinical trials, and clinic visits. But in contrast to these controlled environments, where patients are asked specific sets of focused questions, social media allows users to express open, unfiltered, free-flowing information regarding their knowledge, attitudes, and beliefs. Our aim in this study was to use social media data to examine patients' understanding of biologic therapies, including the risks and benefits associated with them, and to examine their decision-making with regard to the biologic options.
So we use Atlas TI, which is a software for qualitative data analysis, to look at over 15,000 online posts made on either social media or health-related websites by people discussing their experience using IBD therapies, and in particular biologic therapies. And we analyze these discussions looking for themes in these conversations.
And we found some really interesting results. There were 4 common themes, the most common of which was negative experiences with biologic therapies, constituting over half of posts in all. These negative experiences included side effects, such as rashes, hair loss, headaches, and fatigue, but also included potential side effects, such as increased risk for cancer or infection. Next most common was decisions regarding treatment. Subjects expressed worry over whether to start, stop, or modify their treatment. And then positive experiences was another common theme, where patients expressed a symptom improvement or even IBD remission. And then lastly, online information seeking was another common theme, where individuals looked to others for help regarding their decision-making and choosing a biologic, or provided support to their online peers.
So an important takeaway from our study is that we are seeing that more people are going online looking for health information, and in particular for information about IBD therapy. And we think that it's important for IBD stakeholders, be it foundations, physicians, or patient groups, to increase their their presence in social media, so that when patients go online looking for that information, they can find it in the places where they go looking for that information.
And from this, we think there are several future potential research projects. We've seen how social media can be a promising epidemiological tool, and with a growing number of available social media users worldwide, social media should continue to be a valuable resource for years to come. We saw in this study how social media revealed a dynamic range of themes governing the experiences and choices patients have when choosing among the biologic options. Hopefully, insights from this study allow us to better understand how patients better navigate the biologic risk-benefit profiles. It seems from our conversations with patients, as well as what's posted on social media, that there also be a tremendous benefit in an online decision-making tool to assist IBD patients and their providers. We know these are very complex decisions, and any online resource that patients could use, as well as providers, would improve decision-making with regards to starting, stopping, or modifying biologic treatment.
Thank you for stopping by and hearing about our work.